It is a common experience for everybody to know that one of our elderly relatives is confused or is losing memory. And in all the families, you can see people that can tell that my grandpa got confused in one occasion or got lost and he didn't know where to go, or my grandma did not recognize my aunt. Cognition is something that is so important but is so taken superficially for us because it's a given fact. All the human being has certain type of cognition for everything. But our capacity to memorize things, to retain, to retrieve experiences, information, to interact with the rest of the society, with friends and family, is there daily. However, as the time goes by, people that is older than 50 years old may have some problems in the retrieving events and problems with memory. The situation sometimes get to a point that the person is unable to interact with his or her own family, and that is called dementia. One of the most disabling problems in our society nowadays. So it is interesting to determine what is producing dementia, which is the history of a person that will go finally to a point of losing his capability to interact with the society or to take care of himself. And then in that regard, the most important disease nowadays is Alzheimer. Alzheimer is becoming a very prevalent disease in the society, and is one of the diseases that take the resources of the society without any, until now, major benefits in the treatments that have been implemented. In the last 25 years, the medications that are used by psychiatrists and neurologists have proven to be of relative importance, and but none of them have been able to reverse the condition called Alzheimer. Alzheimer is a disease that is part of the spectrum of dementias, and it is produced essentially by two components. One is genetic. There are some persons that will have certain genes that predispose them toward the disease, and the other are environmental factors that will have an impact in this. The gene that is related directly is the EPOE4, and we can measure that in the society. There are some patients that may be heterozygous, that means have one count of this E4 gene, and that confers a predisposition of 30% toward Alzheimer. If the person is homozygous, in other words, it has two counts, will have 90% chances to have Alzheimer in the future. And the studies have demonstrated that even in the general population, we have approximately 9% chances for anybody without the gene to become an Alzheimer patient. So what is producing this? Which is the sequence of events that will lead toward this disease. In reality, the human being is exposed to many toxins every day and every minute, I would say. This toxic load is called toxic burden in the body and is accumulating as the time goes by. The toxins that we acquire are coming from the air we breathe, from certain habits of smoking, from certain activities, for instance, people that work in very polluted areas or in contact with heavy metals, or what we eat. In general, in the last 60 years, the amount of fungicides, fertilizers, and some other chemicals that have been introduced in the agriculture to preserve crops and to make them better have, in a way, had a severe impact in diseases. To contrast this toxic burden, the body is able to process some of these toxins and eliminate it through the feces, through urine, through sweat, and through breathing. So everybody is keeping the liver very busy trying to detoxify the body every day. However, since the burden is so big and is daily, finally along the years there is an extra load for the liver, and the capacity to detoxify our body from these toxins become very problematic. Once you get certain amount of toxins rolling in your body, and this successive accumulation of these toxins will lead to our inflammation in our body. And that inflammation, when is fought by the liver and by other organs, and becomes a real problem, then will lead toward the disease formation. And in this regard, if you think that the toxicity will produce inflammation of the arteries, then when the bloodstream is carrying on some substances that will produce problems to the circulatory system, then the diseases may be in any place in our body. The same happens with these people with this EPO-E4, which will have the predisposition toward diseases of the cells that are in the brain called neurons. So the inflammation will lead to our neurodegeneration, because in reality the neurons are unable to detoxify themselves adequately. And then as a final result, we have a condition called dementia, of which many of them is patients with Alzheimer. So, but why is this produced? Well, the neurodegeneration is produced by lack of nutrients. There are some changes in the wall of the neurons that for which they cannot do or process adequately some metabolites and nutrients, and so in general the metabolic pathways in the neurons are irregular and are suboptimally produced. So because of the same problem, the neurons produce substances that are called neurotransmitters. The neurotransmitters are the ones that will determine your personality, for instance, will determine if you are more anxious or with more tendency to be depressed, and the neurotransmitters also will give you the capacity to interact, creativity, to think adequately, to answer to certain problems in life. So it has been proven that in people with Alzheimer or with early dementia, there is an impaired absorption of the sugar inside of the neurons, which in some societies, medical societies, this is a condition called diabetes type 3, which is just an incapacity to absorb adequately the sugar, and then because of apparently lack of insulin receptors in the brain. So Alzheimer is a disease that needs both things in general, needs the genes and needs this toxic burden. The toxic burden will deal with lesser production of neurotransmitters then, and a lower function of the part of the cell, which is the mitochondria. The mitochondria are organelles that are in every system in our body, and if we think that the mitochondria are present in larger numbers in tissues with more energy expenditure or more activity, that is the case of the brain, which occupies approximately 22% of the energy that we produce, along with the muscles. So once you have less dopamine, serotonin, epinephrine or norepinephrine, and some others, GABA, some other substances of behavior, like someone has been calling them, then your interaction with your family and with your friends in your daily activities becomes impaired. The Alzheimer is a disease that is not just from one type. There are subtypes of Alzheimer depending on the impairment the person has. Perhaps all of them keep one common denominator, which is the loss of memory and the interaction. However, if we think in an aging process produced by the same toxins and a lesser amount of hormones in our body, it is not then surprising that Alzheimer's starts when we are older than 60 years old. There is some exceptions in people that are homozygous, that where you can see that the Alzheimer runs in families, and most of the times the presentation is earlier and is hitting people in the around 50 years old age. But from the subtypes of Alzheimer, you have one that is exclusively derived from inflammation that is coming initially from the entire body, but finally sits very strongly in the brain. The Alzheimer number 2 is called trophic, where the inflammation is not as important, but there are some trophic factors that do not allow the brain to work better. In that case, you can see in the difficulties in the production of hormones. Alzheimer in the ladies comes, faster in people with menopause. That means that there are some influence of the estrogens in ladies and progesterone, and the interaction of these hormones will indicate a better memory, or on the contrary, loss of memory. In reality, the woman is multitask and is able to carry on 4 or 5 different tasks at once without getting lost. And that, in a way, in a healthy person, is part the action of the hormones. Then the subtype number 2 is trophic and has to do with hormones. Now there is something that has been determined is in the middle between 1 and 2, and they put 1.5, which is the glycotoxic. In other words, the evidence of high sugar producing inflammatory changes in the brain has been considered a separate subtype of Alzheimer. And the number 3 is simply toxic. Many toxins have been determined in the Alzheimer patients. Some of them in the form of infections, for instance, in the Alzheimer's, the presence of Epstein-Barr viruses, cytomegaloviruses, and some others have been determined by serology. But also the toxins that were related to the activities of that person, like for instance, many people that works in mines and that may have high levels of heavy metals. And some studies have demonstrated that in autopsies of patients with Alzheimer, autopsies that have demonstrated high levels of aluminum in the brain of the Alzheimer patients. And the number 4 is vascular, and is the one that is the results apparently of a profound and severe atherosclerosis that finally will lead toward problems in nutrients and oxygenation of the brain. And finally, we have the number 6, which is the traumatic. Sometimes we forget about traumas that the patient has had, for instance, veterans in war, or heavy trauma to the brain, concussions due to change in the treatment and management of Alzheimer's disease. Dr. Bredesen, who is a physician and a PhD, had been working for over 25 years in Alzheimer. And then he was able to compile of all his experiences in a system that he called ReCODE. That means reversing cognitive decline. So in other words, this has been the most, in my opinion, serious attempt to treat or to prevent this disease, and not necessarily through medications, but through the identification of the phenomena that has led that person toward this disease. So the ReCODE system is dedicated to determine which is the areas that finally have more emphasis in the production of the Alzheimer's disease. And that's the reason for these 6 subtypes. So it has been determined that the person with Alzheimer will start having premonitory symptoms 15 years before the disease appears. So in order to prevent cognitive declining, you need to be doing some sort of test to determine your cognition. So there are several tests, and you may talk to your doctor about this and how you can be tested. It's a very simple test that can be done in the office, and in my case, all my patients other than 45 will have a cognitive test every year. So when you put a patient into the ReCODE system, which is a series of determinations to assess the cognitive level the patient has, then you have a very good chance to reverse the so-called Alzheimer, mainly in its first steps. The Alzheimer is reversible, of course, with the exception of the persons that have been to a conditions of neurodegeneration that are impossible to change. But even persons that have been with Alzheimer for 3 or 4 years can be reverted to a more normal life. So it is important that you read about this ReCODE and to talk to your doctor about the possibilities to be tested or to treat some of your relatives that are suffering from this lethal disease. If you would have some more questions, you may call us to the Institute of Regenerative Medicine at 915-490-0647, and we can provide some extra information. That is in general what I wanted to share with you concerning to Alzheimer and the mechanisms of dementia. Thank you very much.